Hi, we are from Book 2. Today we are going to present about our public awareness poster on the hoarding disorder. In our poster, it will be divided into 3 parts, which are the DSM-5 criteria for the hoarding disorder, prevalence of hoarding disorder in Malaysia, and the role of clinical and counseling psychologists in the treatment of hoarding disorder.
Now, I will briefly explain on hoarding disorder. So, hoarding disorder is a mental health condition that involves a persistent difficulty in discarding or letting go of possession, regardless of their values. So, individuals with hoarding disorders feel a strong need to save the items and experience significant distress when they try to discard them. So over time, this behavior will lead to the accumulation of a large number of items that cause clutter that interferes with the normal use of living spaces such as bedrooms, kitchens, or walkways. So in some cases, the living area may appear uncluttered because family members or others have helped to clear them. So this condition causes significant distress or impairment in social, occupational, and also daily functioning. Hoarding disorder is not caused by another medical condition and is not better explained by another mental disorder. So these features are consistent with the diagnostic criteria outlined in the DSM-5.
Now, we will be presenting about the prevalence of hoarding disorder in Malaysia. For this part, there will be 4 sections, which are related research on hoarding disorder, local expert view on hoarding disorder, real-life cases of hoarding disorder in Malaysia, and local awareness toward hoarding disorder. Firstly, for the related research, we have found 3 articles regarding to this topic. The first article is about hoarding disorder in elderly by Ron and others, 2017. According to this article, hoarding disorder in elderly typically begins before 40 years old and will progressively becomes worse when the person reaches middle age, meaning that hoarding disorder do not just casually appear when the person is older, but has been slowly developing when the person is still in young adult. On top of that, this article also mentions that studies have found that depression is quite common among individuals with early hoarding tendencies, which affect roughly about 14% to 54% of individuals. The second article is about hoarding disorder in working women by Muhammad and others. This article talks about a study that was conducted on 150 working women in 2018, and this study showed that among these 150 participants, 0.7% of them show severe hoarding symptoms and 16% of them show moderate hoarding symptoms, while the majority of them, which is 83.3% of them, show low or no hoarding symptoms. This result suggests that stress from different roles and responsibility at the same time, such as work demand, family expectation, personal matter, and others, can slowly build up, and over time, it will lead to psychological distress, which may increase the risk of developing hoarding tendencies. And finally, the last article is about a psychometric study by Sanin and others involving 102 Malay participants. This study is mainly to discover about hoarding behavior and patterns, and the results found that among these 102 participants, 80% of them reports that they collected unnecessary items, 75% of them reports that they have been experiencing disruption and interference from the item they have collected, and 55% of them reports that they struggle to throw away the item because they fear that they might need it for future use. So overall, this article exposed that hoarding not only just affects someone's emotional well-being, but it can also affect someone's daily life. Moving on to the local expert view, firstly, according to Professor Dr. Richard Ng, the chairman of Koperasi Alam Hijau Perak Berhad, a recycling organisation, he mentioned that 1 out of 50 Malaysians might have hoarding disorder. This number suggests that in Malaysia, hoarding disorder is still a noticeable issue. However, the number can still go beyond that because of some unreported cases. Another expert view from the head of counseling unit at UC, Dr. Fauziah, mentioned that hoarding disorder can get more serious as they become older. Besides, she also mentioned that hoarding disorder may be inherited, making the later generation to have the higher risk to develop hoarding disorder. This means that factors like genetic and family background can influence how this behavior develops over time. However, family support and early intervention can be very helpful for individuals with hoarding disorder.
Now, I'm going to share about the real case of hoarding disorder in our Malaysia. First of all, a case in Kuala Lumpur went viral as a hoarder's item blocked the corridor and stairwell. Meanwhile, in Johor Bahru, a 76-year-old retired teacher who hoarded for over 20 years old blocked the street, which required 15 volunteers to remove 37 tons of waste. Another case in Skudai, Johor, which involved a woman and her two teenage children living in a house that has been filled with rubbish for 2 decades. The woman cried when the volunteers are trying to discharge all her items. Now, I'm going to share about our research result on the local awareness toward the hoarding disorder. In this research, we have collected the data from around 86 respondents. Based on the purple chart that indicate the local familiarity toward the hoarding disorder, there are 16 respondents high familiar with hoarding disorder by scoring above the average, while there are only 26 respondents are less familiar or not familiar at all. Next, based on the yellow bar chart that indicate the local attitude toward the hoarding disorder, there are 18 respondents show a good attitude toward the hoarder, and only 6 respondents show a negative attitude toward the hoarder. This shows that the majority of the respondents are familiar with the hoarding disorder and have a positive perspective on hoarders, which is a good trend in reducing stigma toward the local hoarders. We also found that low familiarity does not necessarily correspond to the poor attitude. Some respondents unfamiliar with hoarding disorder still express a willingness to offer the support to the hoarders.
Hello, my name is Alia Mesara, and I'll be explaining about the role of clinical psychologists in dealing with hoarding disorder. So usually, clinical psychologists will give a detailed assessment and also diagnosis. This is because they are a professional who are specialized in assessing, diagnosing, and also treating any kind of mental, emotional, and also behavioral disorder. They will conduct a clinical interview based on DSM-5 text revised guidelines and confirm the hoarding disorders by ruling out any related conditions. This is important because an accurate diagnosis plays a crucial point to enable an appropriate and targeted treatment for the patient. Moving on, we're going to talk about the treatment. As a clinical psychologist, they usually use cognitive behavioral therapy or CBT because it is an evidence-based and also effective treatment for hoarding disorder. They will also help to address distorted belief about possessions and reduce avoidance behavior in the patients. And they will also try to apply a gradual and also supported exposure to discard items in order to build up the distress tolerance in the hoarding disorder patient. And lastly, they will help to monitor the progress and also adjust strategies in order to prevent a future relapse and to support a long-term change in the patient.
I will be focusing on the role of counseling psychologists in supporting individuals with hoarding disorder. Counseling psychologists focus less on forcing cleanups and more on helping individuals feel understood, motivated, and emotionally supported. One key counseling treatment used is cognitive behavioral therapy, or better known as CBT. In counseling setting, CBT helps individuals identify unhelpful beliefs about their possessions, such as the fear of needing items in the future or losing meaningful memories. Counseling psychologists guide clients to practice decision-making and gradual discarding in a safe and supportive way. This process is done slowly because moving too fast can increase distress and resistance. Another important counseling approach is motivational interviewing. This is especially useful for individuals who feel unsure or resistant to change. Instead of pressuring clients to discard items, counseling psychologists explore their mixed feelings and help them connect change to personal values, such as safety, independence, or improving relationship. Research shows that this approach can increase engagement and readiness to change. Overall, the type of care provided by counseling psychologists is empathetic, client-centered, and long-term. The goal is not just to reduce clutter, but to help individuals develop healthier coping strategies and maintain progress over time. That's all for my part. Thank you.